right. Thank you so much for that introduction. I want to thank SDP for the opportunity to be here. And I want to let you all know, if you ever get a chance to sit through a facilitation session with Jack Kloeber, definitely take it up and do it. It's like watching a great artist at work. He is amazing. It was an absolute pleasure to work with Jack and the Chromite team. And what I'll do today is tell you a little about the activities and what we've been doing actually since we spun out CDA out of Chromite. Center for Disease Analysis was actually a division within Chromite that focused on epidemiology. And in 2011, we started actually modeling hepatitis B and C. We were actually working on a project. Jack and I were working on a project with Sharon Plow. And it was a decision analysis project to prioritize the sequencing of two compounds they had, both for hepatitis C. We pretty much fell into this, where we had to develop models to estimate the burden of hepatitis C. And while we ran those models, what we discovered was that, in fact, it was possible to eliminate Hep C in our lifetime under certain assumptions. And as luck would have it, those assumptions actually came through. The compounds were launched that allowed curing hepatitis C by using essentially 3 months of treatment of antiviral therapy. So in 2017, as Jack mentioned, we started actually a Center for Disease Analysis. And in 2017, we formed a foundation, nonprofit foundation. And the main reason was to allow us to work with organizations like the World Health Organizations and US CDC. And today we work with about 130 countries, regions, to help them really provide decision analytics support to develop strategies to eliminate Hep B and Hep C. And our scope, as you can see, has already expanded to hepatitis B and more recently Delta as well. So our mission is to really accelerate Hep B and Hep C elimination by providing data, disease burden, economic impact modeling, and really looking at the strategies. So this is something that both Jack and I used to recommend for organizations not get into. So when you're doing portfolio management, you essentially are really helping organizations to diversify. So there's a couple of things you'll notice. One was that we started actually focusing on just hepatitis C and then B, which is exactly what we would say not to do if you're actually helping a client. And then the second is that, when we used to provide training, we always said, look, you need to be process experts. And in order to make this happen, we actually had to become content experts. So CDAF has really become content. And in fact, WHO, US CDC, most countries now get their data from us in terms of what their burden is. Our work is actually funded and supported by both nonprofits as well as commercial companies. About 70% of our funding comes from nonprofits and foundations, but 30% do come from companies. And we actually do get funding from WHO. We just cannot use their logo. So every organization is prohibited to ever show a WHO logo unless you're WHO. So what we do is we actually use decision analysis tools to support informed decision-making at the national level. And this was something that we'd identified as a major gap in global health, was although there's a lot of modeling, there really is not the set of skills that decision analysts bring to the table. And in order to do that, we started out by creating the Polaris Observatory. So one of the things that we identified as part of the original Sharon Plow project was the fact that there was a lack of data and lack of agreement or consensus on the available data. And we started slow with just a few countries, and before we knew it, every country was asked if we could do an assessment for them. And what we do is, this is actually available on our website. It's free. You can go on there and look at all the data. And it's actually epidemiology data. We provide modeling tools and training. So we've trained over 40 different people in different countries to run these models, and decision analysis support to really look at the impact of different scenarios and different strategies and what the overall impact would be. And it's actually all provided free of charge to countries. And part of this is to make sure that we really increase the adoption of these tools and skills and actually then transfer it to the countries. Now, what we found in 2017 was, in order to be able to actually achieve the elimination targets, small countries were really struggling with pricing of medicine and diagnostics. And we formed the Global Procurement Fund.